Good evening. My name is Lisa Deaton, and I'm the current Secretary Treasurer for the Louisiana Nurses Political Action Committee. And tonight I'm honored to have our chair, Ms. Patricia LaBrosse, with us, as well as one of the candidates for the upcoming Senate race for Louisiana congressional race on November 3rd. And the candidate we have this evening is Dr. MV or Vinny Mendoza. And I want to say that tonight this is being brought to you by the Louisiana Nurses Political Action Committee. However, the questions that were sent to our candidates and that candidate Mendoza will be responding to are questions that came from solicitation from the nurses throughout our state. Questions were submitted, and then the LAMPAC Board of Trustees made a final selection based upon the most popular or most submitted question. So with that, candidate Mendoza, I would like to turn it over to you for a brief opening remark, please.
Thank you. I'm Vinny Mendoza. I'm running for U.S. Senate, and the reason why I'm running is because I'm concerned about President Trump and Senator Cassidy's response to COVID-19. I believe that they have been negligent, and I'm concerned about too many Americans dying. So that's the primary concern. And also I'm concerned about the environmental crisis that we have that's hitting Louisiana really hard, particularly the Lake Charles area or Southeast Louisiana area. They have been hit by 2 hurricanes in the last 30 days. But in addition to that, I'm also concerned about the economic and social havoc that we are experiencing. The response from Senator Cassidy, as a doctor, he could have stepped up and help the health community receive PPE, and he just didn't do anything. He let his colleagues die, and a person that lets doctors and nurses die in the front line, he's not your friend. And so I'm concerned about providing all the PPE for the health community, but I'm also concerned about doing something about the economy and the environment. So I offer to you my integrity, respect, leadership that comes with faith, hope, and the love of God as my guide. I have over 20 years experience in the U.S. Air Force. I served as an assistant to the Inspector General of the Air Force, and I was also a Chief of Services, where I managed billions of dollars in real property. So I have, unlike my opponents, including the incumbent, I have a 5-action plan that addresses all the concerns. I will share that with you within the questions.
Okay, well, we look forward to hearing from your responses to our question. So I'm going to start with the first question. And currently, gun violence is a public health issue as evidenced by the CDC rankings. What is your position on providing appropriations to the CDC to fully conduct gun violence research?
I believe that I know there is something that is good, but I think that we need to address the problem at the source of the problem. Like right now, we have the President of the United States instigating violence. So when he tells the Proud Boys stand back and stand by, it's giving them, you know, a okay to do violence. So we need to uh, first get rid of the current administration that we have. It's not only the president, but the entire Louisiana delegation. They all support him. So, you know, they're part of the problem. When you support someone that is instigating violence and instigating people to kill others, you know, you have now 13 terrorists in Michigan that were trying to kidnap the governor of Michigan and overthrow the local government. So the problem is within a government. So we need to fix that first.
Okay. Question number 2. Researchers agree that there is a direct relationship between poverty and health outcomes. This has been pronounced during the COVID-19 pandemic. What initiatives would you use to address the effects of poverty on health outcomes and disparities?
First of all, we have to look at the primary reason of the poverty in the United States is the power and greed that we have in Washington. Everything is about the money that politicians receive, and you know, the tax breaks the billionaires receive. Like right now, and during the COVID-19, 10 billionaires have received like $635 billion. They got really rich, and 350 million Americans are starving. They worry about making paying the rent, and so what I would do is first I would do a tax reform. I reduce taxes on 99% of the American people, increase the tax to the top 1%, and tax 50% to all the political contributions. That where the problem lies is with the political contributions. And I would limit the contributions to $2,800, same as people. If the corporations want to be considered as people, we need to give them the same limits as people.
Okay. Question number 3. ACA has made healthcare available to millions, including per diem RNs. Do you support the continuation and improvement of the ACA? If not, how will you ensure all Americans will have access to healthcare?
Yes, I support the continuation of and improvement of the ACA, also known Obamacare, but also believe that COVID-19 has proven to us that we need Medicare for all. So I'm more inclined about going to Medicare for all. If people want to keep the Obamacare, it's okay, but give the option to have Medicare for all. I'm a veteran, and I'm thankful to God that I have 2 types of healthcare programs, but I know that millions of Americans don't have any. So I want to make sure that what I have, everybody can have.
Okay.
So,
Is that it?
yes.
Okay. We are all aware of the rising costs of medications, which often have citizens making choices to feed their families or buy their medications. Oftentimes, when working people are retiring and are on a fixed income, such as Social Security, the cost of medication skyrockets. What are your plans to reduce and control medication costs?
Well, I think the primary reason for having high cost of medication is because everything is controlled by the health insurance companies. So they dictate basically with the political contributions what they can get away with. So I believe that by doing the tax reform and by I was the assistant to the Air Force Inspector General, so I know about the Department of Defense uh, operational mission about keeping the nation safe, but also know that there is a lot of fraud, waste, and abuse. There's a lot of wasteful funding and war profiteering programs that we don't need. So my goal is to invest 10% of the defense fund that is wasted and reinvest it in the in the Green New Deal agrarian reform. This program will create 50 million new jobs and provide for the payment of the Medicare for all. It will give 50 million new jobs and provide $1 trillion of revenue each year. So the money is not going to be wasted, given to billionaires that have government contracts. It's going to be reinvested in the American people. And they will be able to have the Medicare for all, even for senior citizens. They should have free medicine. They work all their lives. They put into a program that is there for whenever they got old. But now Senator Cassidy wants to take that Social Security away from them too. So we cannot afford to do that. We need to consider progressive programs that are good for the entire 350 million Americans, not just for the 20 billionaires. They are the richest people in the United States.
Okay. And our last question. Registered nurses are ranked as the most trusted profession on the Gallup poll. As the largest segment of the healthcare workforce, the 2010 Institute of Medicine report recommended they lead the transformation of healthcare in collaboration with other healthcare professionals and policymakers. How could you assist with getting qualified nurses on national boards, commissions, task force, as well as appointing RNs to your staff if elected?
Well, I know the crucial jobs that the nurses have. Basically, they're the ones that are in the front of the line. You know, the doctors are there, but the nurses are there 24/7. And so to me, I will appoint nurses to my staff, and I would coordinate every legislation that we have with your nurses association, so that we do things that affect everything that affects the American people and that affects nurses. We will take your knowledge and wisdom so we can have a better, especially for Medicare for all. We need to have a brainstorming among the people that are doing the job, not about those that filling out the pockets with money.
Okay.
And I would appoint them to every board there is, and the ones that they're not, when they are not appointed yet, I will ensure that that happens, because you're the ones that do the job. So you need to be part of the decision making. That is teamwork. That's what I learned.
Okay, thank you so much for those responses to our questions. And so we would like to give you 2 to 3 minutes to give some closing remarks.
Like I said, my goal is to provide some hope to the American people, especially people in Louisiana. I know that Senator Cassidy wants to take away the Affordable Care Act from them, and it will be 500,000 people without health insurance. He already let more than 5,600 Louisianans die. And you know, I learned from Roy Benavides. He was a friend of mine and my mentor. He was the last Medal of Honor in Vietnam. And he told me, Vinny, you never leave anyone behind. You leave no one behind, even the enemy. You know, he received the Medal of Honor. He saved 9 Americans, but he also saved 5 from the Viet Cong that were hurt. So that's the type of person that I am. I have no difference for people, the color of the skin or their political association. I love America. I served 20 years. I risked my life to serve the American people and the freedom, and I will leave no one behind. And Senator Cassidy, unfortunately, Klinger or Radar from MASH could have done a better job than him looking for PPE for medical doctors in the COVID-19 response. He has done a lousy job. He doesn't deserve to be our senator. And we need to send someone to Washington, an independent senator that can break that power of greed that we have in Washington. That's what we have, is greed. So we need to cut that. I'm not taking any contributions from no one. I'm financing my own. And to make the point that we need to break away from the dirty money. They call it dark money, but I call it dirty money, because they make people do things that they don't want just because they're receiving political contributions. So we need to stop that. So please consider number 8, VinnyMendoza.com, and may God bless America and Louisiana. Thank you.
Thank you.